Namaste, I'm Dr. Kabita Keyal. I'm a pediatrician currently associated with Clinic 1, Jawla Hill, Sumeru City Hospital, Pulchok, and Vaida Hospital. Basically, asthma is a allergy disorder. What we see is like a hypersensitivity reaction of the airway. हाम्रो जुन सासको प्रणाली छ त्यो कुनै पनि एलर्जीको सम्पर्कमा आउँदाखेरि त्यो सासको नलीहरू खुम्चिएर जान्छ and then basically the child will present with cough. So simple term ma भन्नुपर्दा this is basically an allergy disorder. Asthma is very common, especially in context of Kathmandu. I find like more than 50 to 60% of the child are suffering from asthma, and it's like most of the child will present by the age of 5, even with a single episode. Otherwise, even it can be seen in the children less than 5 years as well. As I said, like this is an allergy disorder. So this is basically, we say two factors. One is genetic and the other was environmental. If anyone in the family is having asthma, like grandparents from the maternal or the paternal side, or any of the siblings suffering from asthma, then the present child also have a risk of suffering from asthma. The other thing I said is like an environmental factor, in which we say it's like basically plants, pollens, any pets, basically the furry animals like cats and dogs, dust, smokes from the kitchen or the like cigarette smoking, when the child is exposed to the cold environment, or if they intake of anything like cold juices or cold things, cold drinks and all, any food which have a coloring agent in it, and then any hard smell, what I found in my patient, any hard smell like perfume, if they are in a house which is newly painted because of that, and when in the summer they spray a powder, normally there is a tendency to use powder like spraying like this over the body, and anything like if there is a damp in the walls where the child is staying. So these are some common things, and like apart from this there are some like insects and pets like cockroaches. So these are few things which like really trigger asthma and cause asthma in children. Yeah, this is a very important question, and this is a really big issue we face in our day-to-day life in the clinic. So first of all, diagnosing asthma and disclosing this diagnosis to our parents itself is a challenge for any of the treating doctors, because then when the moment we diagnose the patient as a asthma, they feel it's a very huge disease, and then the parents are so reluctant, and it may be a thing they don't land up with us again. And the other thing is like the mode of treatment, the mode of delivering a medicine, as whenever we prescribe them, it's fine with them when they are in oral medicine, but whenever we prescribe them with an inhalation, any puff, I'll be showing that in another video. And then what they think is like it's a addiction. And it's a very big social stigma that they are very confused, or they are so reluctant to start off with the treatment. But to say with none of the asthma drugs are addiction, or it's nothing like they have to carry on lifelong, like what we see like TA, like diabetes or hypertension. As I said, it's a allergy disorder. As the child grow up and they themselves start protecting themselves from those allergens, the number of episodes they face or they have to come to the hospital decreases automatically. But in case if they are suffering, these medicines are 100% safe. And in fact, recently we have studies which say that we can even take these medicines to make your life comfortable lifelong, like other medicines of diabetes and hypertension. So this is my humble request to all my parents or all my patients, कि please don't think कि asthma medicine is an addiction. It's like a treatment what we give for other disease. But yes, this it's given for a longer time. Yeah, that we agree. But then we, since the child suffers very frequently, so we need to put them on medication for a longer term, like 6 months to a year or so, or even more than that. But absolutely, these medicines are absolutely safe, not to be scared of. As I said, like most of the children may present with the asthma symptoms first time by the age of 5 years. So bigger children may present anytime, any number of time. They may have any number of attack depending upon the genetic history, family history, and then if they have an underlying condition like atopy, associated allergic rhinitis, and adenoid hypertrophy as well, what I usually come across, or if they have a very frequent attack of asthma, then they have, it's better they see their physician doctor and get them started on treatment. But the general public tendency is that they, because the child usually present with cough and cold, so they usually go to the pharmacy, they purchase a medicine over the counter and just have it, but without actually knowing what is the cause of cough or cold. It may be because of asthma, so a general cough medicine wouldn't help for sure. So what my request to the parents are, please consult your doctor on time so that you don't land up with this complications or the severe stage of asthma. So early diagnosis is very important to make the children life better and to make them less suffer. So it's better to visit your doctor as soon as possible.